GutPunched, Alzheimer's and Caregivers. Navigating the insidious illness of Alzheimer's is something nobody asks for. The disease sneaks up on you and your loved one, and it feels like you've been sucker punched in the gut. Then you ask, where do we turn for help? Who do we call? What do we do? These questions and more are what we hope to answer and give you some direction and hope. Now let's join our host, Jeff Edwards.
Greetings and welcome. Well, here we are again. GutPunched, Alzheimer's and Caregivers, episode 33. Now, our last episode was also named No Tropical Hurricanes This Week. The countdown continues. Well, we're in the countdown now. Can you believe it? Who would have thunk it? This is crazy. Okay, enough complaining about the weather. Let's get positive. Today, we're going to cover an article about nighttime light exposure may raise Alzheimer's risk. And we have part 2 of a very good interview with Dr. Adam Perry from HealthSpan Partners. He'll continue to explain in depth the new government program from Medicare and Medicaid called The Guide. If you haven't heard about it yet, give this a listen, especially if you're a caregiver and you need some help. This might be for you. And we'll update you on some of the final walk for Alzheimer's locations for the next few weeks. Now, my wife and I participated in our first walk in Fort Myers, Florida, and it was really pretty cool. Great crowd, great enthusiasm, and all for a good cause. And we're surely going to do it again next year. Okay, you know what's coming. What are the 3 rules we follow here at GutPunched, Alzheimer's and Caregivers? 1, you have to take care of yourself because if something happens to you, who's going to take care of your loved one? Number 2, you can't do it alone. You need help. Find good caregiver groups or network with friends and relatives. And 3, make a list of people, friends, relatives, co-workers who have offered to help you in time of need, and then make a list of things you need done but can't do yourself because caregiving duties are overwhelming. Use the lists, start at the top, and keep going till you get what you needed done. And you'll find it very helpful. All right, it's time. So let's begin. We're going to take a look at an article written by Dennis Thompson. It's called Nighttime Light Exposure May Raise Alzheimer's Risk. People who live in areas with more nighttime light pollution could be at an increased risk of Alzheimer's disease, particularly in those in middle age, a new study says. Nightly light pollution is more strongly linked to Alzheimer's disease in people 65 and older than other known risk factors like alcohol abuse, kidney disease, depression, and obesity. Researchers reported that September 5th in the journal Frontiers in Neuroscience. And light exposure poses an even greater risk to the brains of people younger than 65. High nighttime light intensity was the top risk factor for early onset Alzheimer's in that age group. We show that in the U.S. there is a positive association between Alzheimer's disease prevalence and exposure to light at night, particularly in those under the age of 65, said lead researcher Robin Voigt-Zuwala, an associate professor at Rush University Medical Center in Chicago. Now, nightly light pollution, a modifiable environmental factor, may be an important risk factor for Alzheimer's disease, Voigt-Zuwala added in the university news release. For the study, researchers analyzed light pollution maps for the 48 continental states, comparing them to national data about Alzheimer's disease incidence and known risk factors for the degenerative brain disease. Light pollution appears to be an Alzheimer's risk factor for seniors, but it's not as strong an influence as other factors like diabetes, high blood pressure, and stroke, the results showed. But no other risk factor outpaced light pollution for those younger than 65, researchers found. The results suggest that younger people might be particularly sensitive to the effects of light exposure at night, although it's not clear why. That's what the researchers said. Genetics that increase a person's risk for early onset Alzheimer's impact the response to biological stressors, which could account for increased vulnerability to the effects of nighttime light exposure, Voigt-Zuwala theorized. Additionally, Younger people are more likely to live in urban areas and have lifestyles that may increase exposure to light at night. Given these findings, people might want to limit their exposure to bright lights at night, researchers said. Easy to implement changes include using blackout curtains or sleeping with eye masks. This is useful, especially for those living in areas with high light pollution. Now, light exposure inside a home could be just as important, the researchers added. People should limit their exposure to blue light, which can affect sleep, and install dimmers in their home. Interesting. Nighttime light exposure may raise Alzheimer's risk.
We'll be right back to GutPunched. Alzheimer's and caregivers.
My grandmother had Alzheimer's, and I remember we were all in the hospital room, and for like 10 seconds she recognized who we were, and then it was gone. So it's like a thief. It's taking away memories and who you are as a person. Over 5.5 million Americans have Alzheimer's. That number may double by 2050. For more information, visit rightfocus.org.
This is GutPunched, Alzheimer's and Caregivers.
In our last episode, we began a conversation with Dr. Adam Perry of HealthSpan Partners, where we discussed the guide program that is available to caregivers. Our interview was a bit long, but filled with great info, so we decided we would break it up into 2 parts. That way, it would be easier to digest and have a more meaningful impact. And now, here is part 2 of that interview. Dr. Perry. How can people get involved with this program? Are there special requirements? I know there's a difference. You have to have regular Medicare and not the extra plan. And does it cost people to get involved?
That's a great question. I should always start with that. Totally no cost because it's from the innovation unit, which is a separate fund. You can think of it that way. There's no cost. There's no co-pays. It does not affect in any way other benefits or relationships with providers or home or community-based services. The eligibility is that, someone with dementia, it could be mild dementia, moderate, severe, any type of dementia, Alzheimer's type, undifferentiated, late type, Parkinson's associated, you name it. Someone that has to have traditional Medicare, and that means not Medicare Advantage, and not in a PACE program or hospice. And the residential status now, people who are not eligible if they live in a long-term care nursing home. And that means generally a nursing where they have skilled needs constantly, and that's oftentimes picked up by Medicaid. But Medicare is interested and encouraging people with dementia who live in senior living, independent living, assisted living, memory care. Medicare is very interested in helping that population, partially because they sometimes suffer from avoidable hospitalizations at higher rates.
Right.
And part of the goal here is to avoid that as much as possible. So it's a big group of people who are eligible, particularly here in our area.
How does somebody get involved? Is there a number to call, or they got to fill out paperwork or a website? What are the steps?
Yeah. So these are still sort of regional, and if you're in a different state, and really the best way to find a model in your area, or participant in your area, is just to go to the guide website. So if you CMS guide, so CMS, Centers for Medicare and Medicaid Services, guide. If you put that in the search engine, it'll take you to the guide site. You can put in your address or your zip code. It'll tell you who's participating. Again, there's only 95 programs in the country participating in 2024. In the middle of 2025 in July, there will be another 300. So people, throughout the country may not be able to find a program in their region currently. But if you're here in Southwest Florida, we're participating, and certainly you can call our number or go to our website and sign up online.
Yeah, I'll give people that at the end.
Absolutely. Sounds good.
Phone numbers and links and everything else, because sometimes it's like, well, what did he say when he talked? And then eventually,
I appreciate it.
Yeah, and then eventually too, I'd like to hook you up through my website and at least have a link there that they can go to the guide.
I appreciate it. Yeah, we follow up quickly, and again, our role here is to get this benefit out there, introduce eligible people to it, and then build a network of people, of providers in the community who can benefit from this as well. We partner with home care agencies, we partner with senior living, we partner with provider groups. we partner with nonprofit agencies who are already serving the dementia population. And many organizations are already doing much of this model or parts of it. They're doing care navigation, or they're doing assessment, they're doing respite. And Guide is designed to support these organizations in each community and really grow and strengthen the connections between those senior services agencies that serve the dementia population. And so it's got a dual role here of supporting families and people with dementia, but also helping to develop that network with a consistent revenue stream.
Mm-hmm. So I go online and I say, okay, I think I can qualify for this. Mm-hmm. Then I go, to your website, and I'll click in. Mm-hmm. So what happens? So I register my name, somebody call me, somebody reach out, or phone conversation prior to?
That's a great question. And that's, so it gets to the operational details. And so if you, call the phone number, or you went on a website for, our model, if you were here or somewhere else, depending where you're at, because this is 95% done over the telephone, set up a time to have a phone call or a Zoom, whatever is better for the person. And often we're talking, to a family caregiver or an unpaid caregiver. And so they'll screen for dementia, or for eligibility rather, just to say, hey, do you have a diagnosis of dementia? Make sure you have traditional Medicare, that red, white, and blue card that doesn't have a name of an insurance company on it. Mm-hmm. And then, of course, there's voluntary consent, and that's special in this program. And innovation unit programs, dementia, the consent is oftentimes dealing with the person who has sort of surrogate decision-making capacity. And then once you go through those sort of initial steps, eligibility and consent, then you make sure that you've got the diagnosis. And then there's a comprehensive assessment. And Medicare has put together different domains to assess, sort of a cognitive domain, a caregiving domain, a home safety domain, behavior and psychiatric symptoms. And it's really a questionnaire, mostly done over the phone, although it can be done in the home. And there is a home visit. Most people in the program will have one home visit at the outset of the program. It's an 8-year program. So the first year, there'll be a home visit. And then that assessment will be used to develop a care plan. The care navigator and the provider, doc or nurse practitioner, will make a care plan that involves connection to community-based resources, medical transitions of care, some of this, medication suggestions, although we're not managing it, suggestions for other providers. And then that's kind of your onboarding. Now you've done an assessment. We know what your needs are and what your strengths and your goals are. And then the care plan is wrapped around those goals. And then there's an ongoing relationship, open phone communication, open monitoring of the care plan. And then every year, at least once a year, there's another reassessment. You go through the questionnaire again, you see where you're at with the care plan, what new challenges have you had, how do we help you address it? And in that time, we generally talk to someone at least once a month. If they don't call us, we call them in general. Mm-hmm. But certainly early on, we talk to people a lot more frequently than that as we get them connected to resources.
Sure. Now, do you have patients that have entered the program, and what's their reaction to it at this point?
Yeah, we do. We are enrolling people since mid-July or so, and it's been overwhelmingly positive. And it is that really someone to call. We found that the benefits are the ability to call someone and the care navigator and, hey, here's an issue. How do we manage it? Or what resources could we utilize? And we find, we've had a pretty even distribution of beneficiaries with mild dementia, moderate dementia, and severe dementia. And what we're learning is that the program has benefits at every stage, and the benefits are a little different. The caregivers who are helping loved ones with mild dementia oftentimes will benefit from initial education, like, what is this type of dementia? What should I expect? And then in later stages, here's a day program, or here's some respite, or here's connections to other types of resources, specialty type resources that might help in later stages. So it's been very, very, very beneficial. It is a new Medicare program, so the rollout, technically, there's about a 3-week process where we present the person to Medicare. And because they're just getting started, it takes about 3 weeks to get enrolled. We do an assessment, we present you to Medicare. They do on their side check benefits. They make sure the person's not enrolled somewhere else in the country, and then they get back to you. So hopefully that'll speed up. But they've been doing just a tremendous job with a brand new program.
Very good. That's really good to hear. That is, even though it's just beginning, it's being accepted. I don't know how much marketing that the federal government has done for this. That's a whole nother issue. But as more people talk about it and hear about it, word of mouth is going to be good for somebody to say, okay, I want to find out more about that. So with that, I would say, can you give me like 3 good reasons that we can share it with the listeners that would make them want to participate? You kind of talked about them, but if you could just kind of like 1, 2, and 3.
Yeah. And so the overall, before I give you sort of 3 points, is that this is it's an entitlement. It's a benefit, just like any other Medicare benefits you have. And so it's no cost. So that's a great reason to participate, but it's an entitlement. People should know about it. But say 3 reasons to activate this entitlement is the big picture is now, for the first time, within Medicare, people with dementia and their caregivers are not alone. And so having a care navigator who's expert, who has done this before, who has specific training to talk on the phone, to guide you through finding resources, an ear to listen, that's a tremendous advantage that wasn't available before this program for no cost. So there are aging life specialists and geriatric care managers out there. This is that role, but it's provided at no cost. And so another point is, for the caregiver specifically, the support and training is specialized. There's a lot of online modules. There's ad hoc support groups. Groups that have gotten really, really innovative with how do we meet caregivers where they are. And just, knowledge is power. And so this is a formalized way to get that. And of course, the respite benefit is a tremendous new and really novel benefit from Medicare to pay for this. Talked to a fellow not that long ago. He, had cataracts. He's been putting it off for 3 or 4 years because he's, taking care of his spouse. So I wish I had the 4 or 6 hours to get the cataracts done. And we said, well, now with this program, that's a great use of your respite benefit. Yeah. And last I heard, he was able to get somebody in the home to take his wife out, around the neighborhood or whatever, and he can go get his cataracts done. So that's just an illustration of the respite benefit, which people really value, and it's totally new. So there's 3 off the top of my head, Jeff. Good.
Now, while we're talking, I had another thought, because we talk about Florida. You and I are both located in Florida. Now, what happens if somebody is what we call a snowbird? They spend half their time here and half their time someplace up north. When it gets hot here, they go home, and when it's cold up there, they come back. Would that affect somebody's standing as saying, well, I signed up here and I'm talking with somebody in Southwest Florida, but now I got to go back to Ohio, and does this follow them? Do they continue, or does it affect it at all?
Yeah, that's sort of a unique challenge for us here. And I'll do 2 points. For our seasonal residents, oftentimes they're not as ingrained in the community here as maybe they were up north, as far as their access to community-based resources and really just knowledge of how to reach out. So this program has tremendous benefit for our seasonal residents. That said, you can't participate in 2 different programs. And that's one of the things that Medicare does when, in their integrity check, is make sure that someone's not participating in, say, Ohio and in Southwest Florida.
Okay. Makes sense.
And currently, because there's so few programs, people could certainly join here. And because it's done over the telephone and the relationship is with the person with dementia and the caregiver, certainly whether you're back home in Ohio in July, that relationship continues. Good. And many of our family caregivers, as you know, are here. They're in Wisconsin or Pennsylvania. So this is largely done over the telephone. We're glad to have any seasonal residents.
Yeah. All right. So let me ask you, HealthSpan Partners. That's the name of your company.
The idea here is that the role of, say I'm a geriatrician, and the role really of everyone involved in senior services, particularly, or clinical and community-based support, is to help people to function at the highest possible level for the highest possible time. And so people, have been talking about this concept of health span versus lifespan for a while. So I've always thought that was a neat concept. So, and then partners, and that the guide program, from an operational standpoint and from a dissemination standpoint, is the development of a network of organizations that serve people with dementia. And the GUIDE program is sort of the glue that helps stitch them together and support them. So in that, my role is to find partner organizations and to help them serve their people. I thought, well, that's really what we do with the GUIDE program is we partner and we help them disseminate this model and administer this model. HealthSpan Partners.
Gotcha.
That's how I came up with it.
That makes sense.
And this is, my entity. I don't have, private equity backers or capital backers or any of that kind of thing. This is my passion. I've been involved in the care of high needs older adults for quite some time. And then I have partners who do care navigation and do respite. So that's, where we're at 3 months in is developing a network. We've probably got 4 care navigators currently, which is, certainly adequate for the volume we have now. But the beauty of this model is it helps you add on care navigators as the population that you serve grows.
I think it's an excellent program, and I usually don't say that about anything the government does.
Yeah, for sure.
But because it's close to home, I looked at it with an objective eye, I suppose. The more I read, the more I thought it was really a very interesting thing, and the way you explained it, it makes it a lot easier, and that was the key. People that I come in contact with, I tell them about, you got to check this program out, and that's how it's gonna grow, at least locally. Yeah, it's phenomenal because I had as a caregiver, I had to learn by myself, and locally we have the Dubin Center, and that's where I went, and I swear by them, and I had to educate myself, and I read and I study and I try things and talk to people, and this wasn't available when I needed it. As I look at it, and maybe somewhere down the road it might be, but it's just something that people should know about. I think it's a great program.
Well, I appreciate it, and just as sort of a few points there is, this is there's no commitment with this program in that anyone with dementia and traditional Medicare can participate, and caregivers need not participate. We have plenty of people here in Southwest Florida where they've got a child or so that lives back up north, and they're not participating in the program. They're not doing the caregiver education and that sort of thing. They just participate really to give the voluntary consent. And we have people who are in facilities here, and as I mentioned, Medicare wants us to find and service that group whose caregivers or family are back up north, and they're a good fit because we can sort of help try to keep them out of the hospital. A lot of that's medication management, keeping people aware as they move through the healthcare system. But you make a good point, is how do you find out about this? And what we've learned is that is really one of the challenging operational aspects initially, is you can't sort of just call people and say, hey, we have a new Medicare benefit. As it works out, people get that phone call all the time.
Right.
And so working with trusted sources of information like yourself, or working with trusted service providers, doctors groups or home care agencies, nonprofits, that's really how this is going to get out there. And I'm really just grateful for any opportunity to talk about it to groups that can introduce this benefit to people, because it's an entitlement, and people should know about it.
That's very cool. Dr. Perry, we appreciate your time today and bringing this amazing program to our listeners. It's called The Guide. Check it out today. And how can listeners contact you? We got a phone number or website?
Yeah, the website is HealthSpan, SWFL.com.
Good.
So that's HealthSpan, SWFL.com. And then the phone number that gets to a care navigator is 239-207-2280. And if you're outside the area or you're just looking for all the programs, it's the CMS website. So if you just go to a search engine and CMS, Guide, Centers for Medicare and Medicaid Services, Guide, GUIDE, pull up a list of all the programs in the country. There's 95 right now. And you can search by your zip code and find if you do have someone serving locally.
Excellent.
We'll be right back to GutPunched, Alzheimer's and Caregivers.
Are you the caregiver for someone living with dementia? You're not alone.
I was a caregiver for my wife for 10 years, and it was a lot of work.
I'm a caretaker for my wife who has Alzheimer's.
I'm a caregiver of my husband that has CTE, and it's incredibly challenging.
The Dubin Center in Fort Myers has been offering free educational classes and support since 1995.
The Dubin Center has helped me exponentially with so many questions answered. It's just been great.
This is GutPunched, Alzheimer's and Caregivers.
And don't forget, register today for Walk to End Alzheimer's. Together, we can end Alzheimer's disease. Find your 2024 walk. Go to alz.org. That's the Alzheimer's webpage. And on that, you'll see information. And it's held annually in more than 600 communities nationwide. Walk to End Alzheimer's is the world's largest event to raise awareness and funds for Alzheimer's care, support, and research. Register for your local walk. You can start or join a team and invite others to walk with you. Or you can start fundraising and sharing. The Alzheimer's Association makes it easy with tools like Facebook fundraisers and their ALZ fundraising app, and there's a lot more. Also, join us on Walk Day. Come together for an inspiring community event that celebrates our commitment to ending the disease. There are a couple more walks coming up in Florida. St. Petersburg will have one on November 23rd, as will Broward County. And then the Treasure Coast on the east coast of Florida will have a Walk to End Alzheimer's event on December 7th. You can go to alz.org and you can find out if there's going to be a walk near you. We hope you enjoyed part 2 of our conversation with Dr. Adam Perry. There was so much more information about the guy that he shared, and we hope you found some information that will be helpful to your circumstances. Not sure what we're going to focus on in our next episode, maybe an update on hurricanes. Well, sometimes we never know. If you know someone who has a family member or friends who are dealing with a loved one who has Alzheimer's or any type of dementia, please share this podcast with them as we try to grow it to reach more caregivers. We would appreciate that very much. For more information, you can check out Alzheimer's Support Network at alzsupport.org/about us. The Dubin Center, very helpful place, dubincenter.com. And to find your local chapter of the Alzheimer's Association, you can visit alz.org/local resources/find your local chapter. And Dr. Perry's HealthSpan Partners website is healthspanswfl.com. And a link to the guide is cms.gov priorities innovation-models and guide. Google it, you'll find it. Our website is gutpunched.com and the email address is gutpunchac@outlook.com. Thanks for joining us, and please come back again for more. God bless.
This has been Gut Punched, Alzheimer's and Caregivers, with your host, Jeff Edwards. Don't forget to hit that like button and subscribe to us on all the platforms like Spotify, Apple, Pandora, and more. If you have a question or want to get in touch, our email is gutpunchedac@outlook.com.